Moving on to the next question. My 10-year-old daughter has been feeling weak and getting frequent infections. Her recent blood test showed very low white and red blood cell counts, and the doctor mentioned aplastic anemia. What causes this, and does she need a bone marrow transplant?
So I'm so sorry again to hear about this child. And aplastic anemia is a serious blood disorder where the blood cells, the three major blood cells, as we were discussing earlier, white blood cells, red blood cells, and platelets, are either not produced in a good amount, or if they are produced, they are being like consumed. So you really don't see those cells in the peripheral blood. So these patients have low white blood cell count, low platelet count, and low hemoglobin, leading for them to require either blood transfusions or platelet transfusions, or at risk of infection. Aplastic anemia is diagnosed usually with the way with bone marrow aspiration and bone marrow biopsy, which is a diagnostic test performed by the doctors, going to the actual source or factory of blood cells and bone marrow. So testing the bone marrow would identify and diagnose this disorder. If the child has already been diagnosed with aplastic anemia, the treatment includes bone marrow transplantation or immunosuppressive treatment. There are two different types of treatment. It depends on whether the patient has a suitable donor to be used for bone marrow transplantation. An ideal donor is a full sibling, say, who could donate, who's healthy enough to donate bone marrow cells. The donation for the donor is really not complicated and safe for a donor to donate. It is extremely hard to even understand a child could donate a bone marrow, but it is a safe procedure for a child to do, and that those bone marrow cells donated could really save their sibling's life. And it is a curative treatment for sure, with a very good outcome. If the patient does not have a full sibling and not a good donor overall, then they can either be treated with immunosuppressive treatment, which includes a combination of drugs like medications to treat this disorder. But most doctors would prefer a bone marrow transplantation if the good donor is available for aplastic anemia. Mm-hmm. So it's a specific case. If there is more details I could give a more specific response to this very question.
Mm-hmm. Thank you so much, doctor.